So welcome everybody. Thank you so much for attending today's webinar. We are about to go through and launch our Workforce Transformation Academy, where the aim is that we are working collaboratively across boundaries and systems to promote effective workplace cultures and for people to be working in an environment where they know where and how they're contributing from their expertise, and also working on what matters for the people that we are working with. So today's workshop webinar is hosted by Impact at UEA, and for those of you who are not familiar, I will ask my team just to introduce themselves and we will be guiding you through today's webinar. So Kim, you're first in the corner there. Would you like to just say hello to everyone, please?
Yeah. Hello everybody, my name's Kim Manley and I'm a Professor of Practice Development at Impact. Welcome.
Thanks, Kim. Jonathan?
Hi, good afternoon everyone. As Sally said, it's really great that you've been able to join us. I'm Jonathan Webster. I'm Professor of Practice Development and Co-Director of the Impact Research Group.
Thanks, Jonathan. Emily?
Apologies. My name is Emily Delver. I'm the Project Administrator for the Impact Research Group.
Thanks, Emily. Carrie?
Hi everybody, I'm Carrie Jackson. I'm Associate Professor for Practice Transformation and Director of the Impact Research Group.
Thanks, Carrie. And then we have two of our colleagues from Health Education England with us today. Saffron, do you want to say hello?
Hi, good afternoon everyone. Saffron Wolfe-Wills, Workforce Transformation Manager, Health Education England, East of England.
Thanks, Saffron. And Phil?
Thank you. Good afternoon, colleagues. Phil Carver, Regional Director, East of England.
Thank you. So you will be hearing from colleagues as we go along. So next slide, please, Emily. So in the next slide, you will see the structure of the webinar, and I will hand over to Jonathan, who will take us through what to expect.
Yes, so thanks, Sally. So our aims for the next hour are firstly around introductions to the team, which we've done. So we've introduced ourselves as people from Impact and also HEE in the East of region. Our colleagues, Phil and Saffron, will talk about why do we need Collaborative Workforce Transformation Academy and its imperative nature at this current time, what the prospectus of possibilities is that the Workforce Transformation Academy can offer. We'll also aim to cover how do you commission different activities and so what they will cost. Key to the launch today is also the launch of our communities of practice, which have no cost associated to them at all. So we will cover that later on in our presentation. Also, how do I get involved? And how will we be sort of working with you if you'd like to sort of join with us as part of the Workforce Transformation Academy, and also then our next steps. Next slide, please, Emily.
Thank you. So what we're talking about today in terms of a Workforce Transformation Academy is if you imagine a sphere or a spiral, that the journey that we're entering on together through the collaborative working is like a praxis spiral, where every time we go back to an issue or share information and get together to fully understand the complexity of the work that we're doing, hopefully through that shared learning and a safe environment to explore, innovate and initiate new things, we will continue to learn from each other, gain deeper levels of understanding and address the critical contemporary and new paradigms as they emerge. So this is going to be very much a living academy where all of you are involved in helping us to shape, form, reform as we embed and evaluate what we're doing to get it right for people. Thank you. Next slide, please, Emily.
So the overall purpose of the Collaborative Workforce Transformation Academy is really to provide the systems architecture for us to grow a critical mass of skilled facilitators and leaders with all the skills required to support transformational change across health and social care, and focusing on what matters to people. We have 3 core themes that have informed the Academy, and these have been developed from working with our stakeholders in the early development stage of impact. So the 3 core themes that underpin it are leadership development and linked to culture change for transformation, facilitation in all its complexity of workforce transformation, and developing and evaluating best practice in practice to benefit practice and services immediately. And this will be achieved through shared learning, embedded research, inquiry-driven improvements that integrate knowledge-rich cultures for transformation where everyone can thrive and develop. I'm now going to introduce you to Phil, who's already introduced himself, Phil Carver, as Regional Director of HEE Eastern, who will now offer his perspectives on this initiative.
Thank you, Kim. So why do we need the Workforce Transformation Academy? So this supportive infrastructure clearly is needed to enable the cross-fertilisation of ideas within workforce transformation and to enable us to deliver on our key priorities in the East of England. And that's by sharing and learning from national and international transformation. And this is particularly pertinent now, and this is particularly important as we introduce working across the newly formed ICS structures, and also a formation of our ICS people functions as we move towards a legislative change from next April as well, and very much as we're in the recovery and reset period, certainly between now and 2024 as well. So particularly important and timely also. So the programmes of work will obviously support system-wide integrated working across health and social care, informed by evidence and supported through upskilling, education and training. Clearly the Academy offers programmes in communities of practice, and obviously these will complement existing offers from Health Education England around workforce transformation and through the STAR model as well, and our new roles and ways of working, which are priorities to address current workforce challenges that we see. And then also it's going to complement the work delivered by colleagues in NHS E&I through the NHS Leadership Academy, and in particular their systems with the leadership and talent management programmes as well. So clearly centrally embedded in the East of England, and very much needed in terms of the here and now to really take us forward, to really have the biggest impact on addressing our workforce challenges that we face today. Thank you.
Thank you, Phil. Next slide, please. And Carrie, do you mind coming on camera and talking through the work that we have undertaken with HEE and some of Phil's colleagues, and explain what these little blue houses all mean?
Yes, thank you, Sally, and thank you, Phil. It's been a privilege to work with Gareth George in particular over the past 12 months, where we've been co-creating the potential architecture for this Workforce Transformation Academy, based on a number of foundational principles which look like these little houses along the bottom. And one of those is around how do we optimise the impact of interprofessional CPD so that we know that the investment that we're making in the workforce actually makes a difference to patient experience, safety and outcomes, as well as staff well-being. And there's a huge range of evidence that demonstrates that many national programmes that we currently invest in can't actually demonstrate value for money. So focusing on the workplace as the main resource for learning, development, innovation and improvement has been really critical to this. So building on that, the learning environment is critical to enabling people to feel as though they are in a supportive, psychologically safe learning environment that enables them to be the best that they can be. And we've done a significant amount of work, which you'll hear a bit about later when Jonathan's talking about the guiding lights of effective workplace cultures that are safe places to work and enable everyone to flourish. The third building block is around how we help to promote system integration, working with our colleagues in social care to support the development and transformation of the social care sector together. And Jonathan and colleagues have been involved in a number of projects around transforming the care home sector in particular, which we know from the first wave of the pandemic was really crucial to focus on. The fourth foundation is around how we innovate practice learning environments so that we're operating opportunities to expand not only placement provision, but enabling our students from all professions to work together in real time, because the ICS model requires us to work in new and different ways with a focus on multidisciplinary learning. So one of the outputs that we've been engaged in recently is the new personalised curriculum for interprofessional education, which enables people to have placements in the private, voluntary, independent sector for social prescribing, and is very much with a focus on public health and well-being and the social determinants of health, which we know at the moment through COVID are really critical to reducing health inequalities. The fifth foundation is knowledge exchange and the importance of having embedded researchers in practice so that we are learning from research that's derived from what matters most to patients and citizens and our staff, and that's able to transform the quality of our services in real time. So these foundational blocks have really enabled us to develop a shared governance model for the system architecture for the Workforce Transformation Academy based on the principles of the Venus model, which I'll talk about in just a moment. Next slide, please. So the Venus model for person-centered sustainable transformation has been created over a good decade's worth of research. And it outlines the evidence that's needed for the workforce to develop 5 key integrated skill sets for effective and sustainable transformation for the future. And these are practice development, which is really about ways of working with people that are collaborative, inclusive and participative. A focus on enabling leadership, but particularly in terms of collective leadership, so that as teams, services and organisations, we're working to get the best out of each other at all levels of the system. Culture change is really crucial, as we pointed to earlier, and improvement and innovation is also critical, as well as facilitation to enable us to make the most of learning, development, innovation and improvement in the workplace. So these 5 key elements of the Venus model have really formed the foundation of the programs that we've developed in the Workforce Transformation Academy at macro, meso and micro levels, which my colleagues will talk about in a minute, that will enable us to build capacity and capability across the workforce for all professions at systems, organisational and team levels. Thank you. Next slide, please. I'll hand you back to Sally. Thank you.
So as Carrie has explained, all of our work is based on a sound evidence base, years of experience of working as practice-driven innovators, and more of that evidence will be shown on the website that you can find our publications and other reports of projects. So for the Workforce Transformation Academy, as Kim has outlined, we worked with stakeholders locally, but also nationally, regionally, internationally, to think about what are the key aspects of help, support, and innovation that people require. And so we've integrated these in what's called our portfolio of potential. And these are at micro level for people that are working as individual practitioners, or you and your teams working together to address real life challenges. We've got a layer of activity that is addressing the meso level of systems working, So that's particular services or whole organisations are commissioning projects with us to address their key priority areas. And then also work that is targeted at a system level, where we bring key players together, people that are leading innovation at a national, international, regional level, to share their learning, to allow innovation uptake to happen at pace and working across the system boundaries that have so frequently caused us to reinvent the wheel over and over again. So we're hopeful and we are confident that the Workforce Transformation Academy can create a matrix offer. And again, we will be showing you more details of that, and you can access that portfolio of potentials on our website. Next slide, please. So Emily, if you want to join me now, one of the ways that we have found useful for people to link with us is to use these QR codes. So what you need to do is scan over the QR code. Emily, you can probably explain this better than I, if you would, please.
Of course. So if you have a smartphone, if you were to open your camera, if you hold it over the QR code you can see on the screen, if you hold it so that the QR code is in your camera as if you're about to take a picture, it should then pop up with a link. Sometimes that's in the camera, sometimes at the top, and you can then click on it and be directly taken to wherever the QR code is taking you. This one is to our prospectus.
Thanks, Emily. So what we've tried to do here is make sure that we've got multiple offers and multiple options for you to keep in touch and find the information you need. So there are a variety of QR codes, each with a slightly different pattern, and each of them taking you to a slightly different area. But this one in particular takes you to the full prospectus that you can browse at your leisure. But what we're also recognising is we want to work in a co-production, co-creation, co-designed approach, making sure that we're getting it right for what you need in your context, in your landscape, in your circumstances. So if you don't see what you need, or you need a blend of what you're seeing in the prospectus, do get in touch with us. So while we wait for the next slide to come forward, I will just explain again that these programs are based around the 3 themes that Kim talked about at the beginning. So we're focusing on the leadership development, where people are recognizing their leadership at all levels. We're not saying leadership happens in only one area of the system. Absolutely, it's about promoting leadership at all levels. Then there's also the opportunity to think about how we are evaluating what we are doing and working from that strong evidence base. And it's also about informing and enabling a workplace culture where all can flourish. This next slide takes you to any questions that you might have around what's on offer. So you will be taken to our website. There will be a form to fill in that just asks you for what is it that you want us to pick up with you and how do we get back in touch. Next slide, please, Emily. So I'll now hand over to Kim, who will talk through the other layer of the Workforce Transformation Academy that does not require costing or commissioning to engage with us. So Kim, over to you to explain what is this community of practice offer, please.
Thank you, Sally. The communities of practice complement the programme offers and are key part of the architecture of the Transformation Academy, the Collaborative Transformation Academy. And simply, a community of practice is really a network of like-minded people who share ideas, motivate, support and innovate together. So it's a fantastic opportunity to build a critical mass of people interested in the same area. So we're starting off with 5 communities of practice. The first one will focus on leadership, and this will embrace team leadership, right the way up to systems leadership and collective leadership in all its form, in all its settings and at all its levels. The second one will focus on culture change, again at every level of the system. The third on inquiry, innovation and improvement, mainly because these are very integrated links within the practice setting. The fourth will be on the facilitation. The facilitation will embrace facilitation of individuals, teams, groups, effectiveness, improvement, all the functions of the Transformation Academy at every level. And the last is the concept of the embedded researcher, which is particularly pertinent to growing the career, multi-professional career pathway for all our professions, so that advanced practitioners and consultant practitioners have the skills needed to really evaluate everyday practice, to implement changes as we go, and to focus on effectiveness that delivers on what matters to people. Now, each community of practice will include executive sponsors, and these will be our ICSs in the regions. It will embrace a co-facilitation model where we work together with other colleagues and higher education institute partners, so that we will work and initiate a co-production approach and work collaboratively together to build that critical mass, which will be a fantastic resource, not just to individuals, but to the system across the Eastern region. So thank you. Now I'm going to ask Jonathan to focus a little bit more on how we're connecting with the communities of practice. Thank you.
Thanks, Kim. So there are 5 communities of practice which Kim has already described, and you can see them listed on this slide. So our first community of practice is leadership, and that will be co-facilitated by Kim and colleagues with executive sponsorship from Nancy Fontaine from the Norfolk and Norwich and Alice Webster from the QE. We've got our second one is culture change, which is going to be jointly facilitated with by myself and Kate Sanders from the Foundation of Nursing Studies and Kath Byford from Norfolk Waveney CCG is our executive sponsor for this. We have innovation and improvement, which is going to be facilitated by Carrie Jackson and colleagues and sponsored by the Eastern Academic Health Science Network. Facilitation is our 4th community of practice, which will be co-facilitated by Sally Hardy with executive sponsorship from Paul Johnson from NSFT. And our 5th community of practice is around embedded research, which is going to be co-facilitated by Kim, Carrie and myself with Claire Whitehouse from James Paget and Katie Cooper from HEE with Paul Morris as the executive sponsor. So this is to give you a flavour of our communities of practice, and our first community of practice for culture change is actually due to meet next week on the 8th of December. So we're looking forward to starting that community of practice then, and the others will follow suit at different times, which will be advertised as well. Can we have the next slide, please? So I believe, Carrie, this is you who are going to talk to this one.
Yeah, thanks, Jonathan. So what kinds of activities might the communities of practice involve? We'll be arranging to meet together at least 4 times a year, but it may be more frequent for people who are working with us, depending on what the interests are. But the sorts of activities that we'll be involved in will be determined by the groups, but they may be creative spaces where we come together to test out new ideas. Sometimes things like learning living labs are quite useful for focusing on wicked problems or transformation priorities. It may be through a webinar series, and you've heard us talk earlier about the 2 webinar series we've had already led by Impact, but we would hope that we will be co-facilitating new webinar series focused on transformation priorities going forwards. We may also run a series of masterclasses if there are particular areas of skill sets that people want to focus on. And workshops and conferences, I think, will also be really crucial to celebrate best practice and to share new innovations and ideas. to speed things up for us all in post-COVID recovery. It's also possible for the communities of practice to work on specific collaborative research projects or areas of curriculum development that may be of a particular focus and interest. But the communities will also offer peer and mutual supervision and support. And we may get involved in social media campaigns or writing blogs if there are particular themes that we want to draw attention to, and any other ideas that may emerge. And in terms of the social media campaigns, you'll probably be aware of both campaigns on consultant and advanced practice recently, and a collaborative campaign around the embedded researcher model led by the James Paget. So those are just a few examples of how we can garner interest quickly. Thank you. Next slide, please. So in a short moment, we're going to move into a film that will showcase what it's like to commission work with us and work together on collaborative projects. And so this film has been created to evidence how work around using the guiding lights for effective workplace cultures has been helpful to services in Cambridge and Peterborough, and also in Essex. So if you'd like to roll that slide, the next slide, and the film, please, Emily, that would be great. Thank you.
Good afternoon, Kirsty and Kelly. It's really great that you've found time to come and share with us your thoughts about the Guiding Lights programme. Can I just ask you if you could introduce yourselves, please?
I'm Kirsty Lynn. I'm the Service Manager for the Children's Community Specialist Nursing Services across Cambridgeshire and Peterborough.
And I'm Kelly Ward, Matron for Community Nursing across Ipswich and East Suffolk for ESNEFT.
Okay, so great to see you both, so thanks for finding the time. So can I just ask you, what reflections and learning have you taken from being part of the National Guiding Lights for Effective Workplace Cultures programme?
So for me, it's been great to be able to have the time out to learn and reflect and generally discuss some of those pertinent items around effective workplace cultures and how we can try and improve that within our own practice. Okay,
thank you, Kelly. And how about for you, Kirsty?
So for me, I think it was great to hear everyone else's stories, to really understand how complex workplace culture is, and that you're not alone with some of the struggles. For me, the Guiding Lights definitely gave a clear framework, one in which I know that I can take forward, and we've only just literally started the tip of the iceberg really to look at it. One of the tools that we used was the claims, concerns and issues. I know Kelly used those as well. And I found that really helpful to give the staff some ownership. It really empowered staff to use that as a tool, thinking about the Guiding Lights and that framework as well, and to really think about our culture. I found that it was a real starting point. But it's certainly not an overnight solution, and it's really going to take time and commitment to embed it, but really helpful.
So can I just ask you, so we introduced claims, concerns and issues to you as a tool that you can use in a number of sort of different settings. Can I just ask you how you use them with your teams for the Guiding Lights programme?
So for me, we've just had some new Band 7 roles brought in for nursing. So I did the claims, concerns and issues around shared leadership, that guiding light with them. And then I gave them the task of going back and doing the same, but for shared values within their own teams. So it was a really good starting point for them to build on with their teams, and actually had some really good feedback around the way staff felt empowered and the fact that they enjoyed having the voice and being able to voice not only the positives, but also where things could be improved, and they were coming up with solutions from that. So it was a great tool that we will be taking forward and using again, and building on those guiding lights with it.
Okay, thank you, Kelly. And how about for you, Kirsty, as part of the programme and focusing on the guiding lights? How did you use claims, concerns and issues?
So we used it I used it in a couple of situations, but the most powerful one was in a workshop with other nurses. and we did the whole flip chart on the walls, all the papers, and I really just allowed them to lead it. I didn't focus particularly on any of the elements, or all of, individual elements of the guiding lights. I just let them just put down what they wanted to, and actually you could fit them into the framework of the guiding lights really nicely, and it was powerful when they saw that. But I let the staff lead, and actually what we then ended up with was an action plan with some really quick wins for some of the issues, and also an action plan that we're still working within now. But also the way that I wrote the action log was to write the claims, concerns and the issues within that, and then the actions. And we sent that out to all the staff so they could really understand where they came from, where the actions came from, and why we were making those changes.
And we talk about the guiding lights. Do you feel that sort of having been part of the programme, it has shone a light for you and your teams on effective workplace cultures?
Definitely. For us, it's really highlighted that now, and it's created a starting point. I think it's been brilliant.
Okay, thank you. So you have both offered and will be joining our community of practice for culture change once we start. How will you see the community of practice supporting you and the teams that you work with and are part of?
So I'm really excited to be part of the community of practice, because we've just started one with all the children's community nurses, so it's great. So I can really see the benefits of it. And for me, the culture change they need time. It needs to be nurtured. And for me, I need to hold that task in mind, because it can easily get lost. And I feel the community of practice will keep me on task, will keep me focused, and then therefore my team focused on actually the work that we need to do within the guiding lights. Okay,
thank you, Kirsty. How about for you, Kelly?
Yeah, I would completely agree. This has been a starting point, and that community of practice will help further that. And it's also having that, being a part of that wider community workforce as well, being in contact with people. Yeah.
Okay, thank you. So anything else you'd both like to share?
So for me, I just wanted to say thanks for the opportunity of undertaking the guiding lights, and also for giving us this starting point to build on. I think it's going to really benefit our teams across ESNEF community.
Okay, thank you. And anything for you, Kirsty?
Just to echo what Kelly said, really, just really grateful for the opportunity and the time and the space to be able to get to know about the guiding lights, and also embed that into our practice every day.
Okay, that's super. Thank you both. Okay, so just before I hand over to Carrie to talk about with colleagues from IC24, I just wanted to say thank you to the amazing Kelly and Kirsty for sharing their reflections on having been part of the Guiding Lights programme, but also to say thank you to my colleague Kate Sanders as well from the Foundation of Nursing Studies, because as Impact we have worked jointly with FONS in both the delivery, and we're currently writing up the evaluation for the Guiding Lights programme, and Kate will also be co-facilitating the community of practice with me. So thank you to our contributors, and I have to say thank you for Rebecca for what you've just posted in the chat box. That is amazing to read that, so thank you so much. Let me now hand over to Carrie and colleagues from IC24.
Thanks, Jonathan. Unfortunately, our colleagues from IC24 aren't with us on camera today, but I just wanted to tell you a little bit about what it's like commissioning and working together on collaborative projects. So IC24 have been talking to us really over the last sort of 12 months, talking about what it's like being a social enterprise with a focus on urgent and emergency care, and thinking about how they position themselves and prepare their senior leadership team for workforce transformation. And so over that period of time, we've focused on the co-creation, first of all, of a programme that will help to support the development of their senior leadership team across localities. So we've been working with their chief nurse, their medical director and our team to co-create very specific systems leadership content that will enable that team to develop. and in turn to embed learning and development strategies that they will use with their staff in their teams and localities to continue to develop the teams that they work with. And then in real time, they're bringing that feedback back into the programme. So the programme is being commissioned for a 10-month period and will enable them to work with us a day a month. In the morning, the programme is structured around active learning, and in the afternoon on action learning, which provides a safe, critical space for them to reflect and test out and try out new ideas with each other and with their teams. And we're going to be undertaking a process evaluation which will identify what contribution the programme has made to their learning and development and growth, both as a senior leadership team, as a system partner, and also to the teams that that run their services in IC24 over that period of time. And then we'll produce an impact report which will highlight and evidence what strategies have worked for whom, why, and in what contexts, so that we can share best practice with them. So that's one example of IC24, but just to give you another couple of examples, we have a particular piece of work that we're going to be doing with Health Education England, East of England, around developing the eye care workforce. So we're working collectively over a series of workshops to enable the co-creation of a career development framework that will help to provide the hooks for a seamless eye workforce development strategy. We have a big piece of work we're just about to start tomorrow with the Gloucester NHS Foundation Trust practice development team. So this is more of an outside of region project. The practice development team in Gloucester want our help, first of all, to help them develop a vision and a strategy for how they're going to embed practice development research across their organisation to evidence impact and effectiveness in real time in a range of different priority areas focused on patient need. So that project kickstarts tomorrow and will run across 3 phases for a period of 18 months. We have another example of where the Venus programme is being used in Greater Manchester, and this is linked to work that we've been commissioned to do with both Greater Manchester and Liverpool John Moores University. That is trialling out new innovative placement strategies for undergraduate nursing, midwifery and allied health professional students. And in particular, they've come to us to ask for our help to design leadership and culture change development strategies for students whilst they're on placement. So we will be embedding a lot of the practice development tools like guiding lights for effective workplace cultures, like claims, concerns and issues that have been mentioned in the chat box for those students to use during their placements. But in addition to that, the people who are facilitating their development whilst on placement, that are leading those teams and services, will also be involved in using those tools so that they're co-learning together in a triad type relationship to reflect on what impact this particular initiative has had. So that's just a little flavour of the sorts of projects that we're involved in, and they've all come through organisations approaching us directly to commission us to do specific pieces of work that are then co-created with those organisations. Thank you. Next slide, please. And now I think we have another film, which is showcasing the work that we've been doing with Norfolk and Waveney Healthcare Partnership. And their experiences of working with us, not only on a COVID project, the We Care Together campaign, which was our first project that we did as the Impact Research Group when we came to UEA, but a number of other projects around the Legacy Nurse Initiative. So if you could roll that film, please, that would be great.
When Impact were launched at the UEA, and we got together to sort of have a conversation, one of the things I was really keen to engage them on was to help us sort of generate the evidence base for workforce transformation. The policy NHS People Plan was really the first time that our workforce has been put front and centre of everything that we do, which is really good news to those of us that worked in the NHS for a long time. You know, this has been something that is much needed, leadership for workforce. So it's quite exciting to think that we can work with a university partner to really start to build that evidence base, because workforce transformation is largely a little bit of a mystery. We've been going together as a team for the last sort of couple of years, and we've certainly tried a lot of things out together, but having a partner such as Impact will really help us to have that objective view of what we're doing and start to sort of build the workforce transformation methodology.
Something very strongly that the Impact team have provided is a very approachable response, allowing us to talk through what our project is and what we are intending to try and look into. And especially when we had individuals who were quite new to evaluation and perhaps hadn't had much experience, it was very important that we selected somebody who would put people at ease, would allow to listen, and to ensure that the individuals understood the process and what the benefits of them collecting the data and the information was, and how they could collect that information.
I think there was sort of a natural partner in terms of thinking about things that we wanted to then think about in a bit more of an in-depth evaluation. So we've had many conversations actually about workforce with them, and they've been very much involved in some of the workshops that we've run to explore what are the education requirements really of our future workforce. What does the future workforce look like, and how can an education partner help us to do the best that we can?
I've sat in a few of the workshop sessions that Sally's done with the legacy nurses, and I think the Americans talk about a sort of folksy style, and she's very good at making the sort of relaxed. She does have a relevant professional background, and I think that gives her some credibility with the legacy nurses. Most people run a mile when they think about evaluations and numbers and all that sort of stuff, don't they? And she's doing a really good job at getting what's perhaps the more difficult side of evaluation, which is putting the flesh on the bones of the numbers actually, and getting people's feelings around it, the stories. And I think we're learning that sometimes stories are much more powerful than just numbers.
I think that it's really, really evident that Impact wants to, the terminology of impact, they really want to make a difference to our workforce. And that really comes through with all the work and interactions I've had with the team.
Impact bring to the table some really well-known individuals that have written quite a lot of work around some of, well, particularly for nursing anyway. So the Impact team, have got a draw on some expertise of people that have written and published documents on different types of workforce. So they're bringing a lot of expertise to the table. They're also sharing research and best practice from other work they've done. So that really does help. And they've put together a really interesting programme on workforce transformation. And when I looked at that, I thought, well, this is really good, because what it does is we offer a bit more of a practical approach to frontline services around workforce transformation, and working with Impact. They then offer the chance for the people that we're working with to actually learn the theory and methodology behind some of the workforce transformation. If we could get some of our frontline staff that we're working with at the moment on transformation to supplement the practical stuff that they're doing with what's Impact offer, I think that would be a really good partnership.
Absolutely, and I was just going to say that I think there's such a lot of good practice that happens in clinical areas, but quite often staff don't realise the value at getting it published and taking it further and sharing that knowledge. So you're absolutely right, and I think the Impact are really good at supporting staff to see the benefits of that, and supporting people on that journey as well with doing and undertaking it, and preventing people feeling so daunted by the fact of what research might mean to them.
So we took photos during COVID and captured people's experiences of what was happening at the time. The Impact team did a really good evaluation and presented us with some themes that we then could add to refresh our strategy and the launch of our strategy. That objectivity but that analysis and synthesis of the narratives that we collected that helped us then understand the themes that were coming through. And it was actually really positive, real strong sense of our workforce coming together, really collaborating, really appreciating, working in sort of multidisciplinary ways. We wouldn't have got that actually if we hadn't have had Impact to do that work for us. We wouldn't have captured those perspectives in such a powerful way. It was one of the first sort of big pieces of work that we did with them, which was good for us because then we could see, you know, the value of actually having a partner, you know, with an education background working alongside us as we move forward on this journey.
I guess that's important, isn't it? This isn't just a once-off relationship, a one transaction, as it were. We've used Impact, we've liked what we've seen for the reasons we've sort of articulated, and we're looking forward to working with them further in the future, aren't we? I think particularly about helping us with the workforce transformation and bringing a degree of, even if it's hidden science and mystery, but yes, science to the arts of actually motivating people and changing workforces.
Impact team has a richness of knowledge. There's expertise from different areas, and I think that's really important to highlight. People from different clinical practices, different experiences, and together that really is impactful for us, because actually that will allow us to learn from different people's experiences, and I think that's really useful.
Yes, what I've heard that maybe we haven't stressed enough so far is the fact that what we're getting is actionable reports. That's something, and that's really what we must have, isn't it? It's not theory for theory's sake. It's very practicable. They do the work, and at the end of it, we've got some clear guidance on what our next steps should be.
You know, we've got Jonathan Webster, Carolyn Jackson, and Kim Manley in the Impact Research Group, and you know, I know of all three. Before I met Impact, I've read works that they've published. They are really, really respected colleagues. You know, big names in in the sort of healthcare world. So I think we're really, really lucky to work with them.
So thank you to all of the colleagues that have contributed their time to show you what it's like to work with us and for you to get a flavour of what's on offer here with the Workforce Transformation Academy. So Carrie, now it's a chance for our audience participation. If you could explain to us, please, what we need to do with the Mentimeter offer here.
Thanks, Sally. Emily, can I ask you to drop the first Menti link, please, into the chat box? So what we're going to do, colleagues, is we've got a series of questions that we would like to ask you just to get some feedback, really, and this is very important to us. So from your experience of being involved in working together, either as part of workforce transformation or in enabling the development of others, we've got 4 questions. And these are: what are the successes that you would like to share? What challenges have you experienced? How might the Workforce Transformation Academy help with these challenges? And what opportunities can you see for future transformation supported by the Workforce Transformation Academy? So on the right in the chat box, Emily has just dropped the first link in. If you click on that link, it will take you through to a slide that will ask you the first question. And then in a moment, I will probably have to move you on to a second slide. We had some technical challenges with this last week, so at another webinar, so we'll see how well it works for us today. So we'll do those first 2 questions first, and then we'll come on to the last 2 questions in just a moment. So I'm just going to go and check that for us now.
Thanks, Carrie. So you will see the link is now in the chat. If you want to go on to that, press that in the chat. You should be able to join the Mentimeter. And then we're asking you to think about what are some of the successes that you would like to share, because learning is about what's gone well as where and what are the barriers that you might need to overcome. thinking about what the challenges are that your experiences in working in health and social care, education, whatever your field of practice is, and how might what you've heard about today, and if you're going to continue to think about how you engage with us, how might this architecture of support and this offer, this smorgasbord offer, help you address these challenges? And then also picking up some of the opportunities of what can you see the future of transformation being supported by the Workforce Transformation Academy, both locally, nationally, regionally, and reaching internationally as well, because the core values and the principles of engaging and working with what matters transcends all areas of the globe. So, Carrie, how do we now? Thank you.
Right. All right, thank you, Sally. So at the minute, unfortunately, we can't duck out of one into another because the technology doesn't allow us to do that. But I can tell you at the moment, I'm just going to read out some of the contributions on the first slide to the first question. What are the successes that you would like to share? And at the minute, we have 14 people participating in that. And some of the key themes that are coming out include developing the role of the advanced practitioner, successful business case setting approved at trust level, time for silence to engage and reflect, so that's for individual practitioners and potentially for teams as well, and a really good point, working with others rather than on them. And I think that's a unique feature of impact work. We don't do things to people, we work with people focused on what matters most to them. There's a very nice example here about linking up with professional CPD appraisal requirements within team activities as a win-win. And another point around being able to create safe space and time for learning conversations. So there's quite a few there. I'm going to move us on now to the next slide, which I hope is going to work. You should be able to see in your slides, if you can't, the second question here, which I'm just going to redrop into chat, only because we know from experience last week that we had similar issues. So if you click on that link that I've just dropped in, that'll take you through to the second question, which is, from your experience of being involved in workforce transformation, what challenges have you experienced? And I'll just give you a few moments just to drop those ideas in, and then we'll come back on and move you into the next two questions.
So in the interest of time, I know we've been talking at you a lot and we've been sharing a lot of information, but I wanted to also emphasize that what you're sharing with us now, we will continue to utilize in how we're shaping the focus and the activities of the Workforce Transformation Academy. So please do continue to drop into the Mentimeter. Carrie, is there any further we can do now, or shall we move on to keeping in touch and what the next steps are?
I think it'd be wise to move on, and we'll make sure that we repost these links to people afterwards so that they've got time to add to it in the expediency of time.
Lovely. So Deborah, if you want to go back to that Mentimeter and keep adding, that's absolutely fine. So what's next then? So we've explained a lot today in this webinar about what the offer is. The initial starting point is that our communities of practice are already beginning to take shape, and we anticipate that there will be a commitment of meeting probably 4 times a year. But as Carrie has explained, this may increase as the group and the COP continues to develop their different areas of activity. And Jonathan will explain in a minute that the Culture COP is already co-designing and developing its work together with its first meeting next week. We've also had a series of webinars that Impact have been hosting and initiating, Our first series was very much about introducing impact. Our second series was about reaching out and connecting. And our third series will start in January, which will be very much focusing on some of the key priorities of what matters for people right now. We've also got lots of activities that we want to keep in touch with you, and we want you to share with others. So Emily, if you could go to the next slide now with our flyers. We've got some traditional flyers that we will be posting out. So again, do let us know if you would appreciate some of the little postcard size flyers around what the role of the Workforce Transformation Academy is. So this is the front page, and on the back again are the QR codes and the 3 core areas of activity. Then on the next slide, we have other mechanisms for you to keep in touch. We've got additional materials that can be found on our website on that first link there. We've also created a narrated PowerPoint that goes over the core principles and activities of a Workforce Transformation Academy, and that can be found on YouTube and is freely available for you again to share with colleagues that you might want to engage with in some of the work, or you might want to forward on to your key leads and financial officers so that you can commission work with us. Our website is available on the UEA site and can be accessed through that link that we've given there. As Carrie and others have mentioned, we try to be very active on social media, and so we are using a couple of these different Twitter handles for the Impact Research Group. We each have our own Twitter handles, and we've also created one specifically for the COPs. We will also be using Facebook, where again others can upload and interact with us as we share the work of the Workforce Transformation Academy across social media. On the other side of the slide there, you will see our Impact logo, which again picks up that spiral and the Catherine wheel of sharing, connecting the dots and spiraling out and back into each other as we share the learning and the knowledge. And there again are the QR codes that will enable you wherever you are to use your mobile devices to get the information you need to make decisions about what, where and how you want to work with us. So next slide, please, Emily. So here we are at the end of the webinar. Thank you so much for engaging with us. Do share this widely, and I'll ask the team now to come back to see if we can pick up any of the questions that you've got on the top of your heads just in the closing minutes of the webinar. We've got a few minutes yet, so we would be really pleased if you could put your questions in the chat, and then if any of us I believe Phil is still here as well, if you want to talk to Phil about the political landscape any further, and then any questions to us as it impacts. Thank you. So panel, any final comments that you would like to share, or anything you've noted in the chat that we could help elucidate further what the Workforce Transformation Academy can offer? Carrie.
I think just an important point that maybe we didn't emphasise enough is that the work is regional, national and international. So we've had some international colleagues here today who've asked how they could work with us collaboratively as well. So this does apply to colleagues across the world, as well as obviously helping to support transformation in our region.
So one of the groups we link with is an international practice development collaborative, and what we've got used to doing is making sure that our meetings are happening at the right time of day so that we can enable people living in completely different time zones to link with us in a time period that's reasonable for them. So we tend to, if we're working with our Antipodean colleagues, to have either very early morning or later in the day meetings, just so that we are all able to collaborate and learn and engage with each other. Thanks, Carrie, for reminding that.
There's a very important point actually that Amanda Howe has raised. Good point, Amanda. She would like to know more about how to avoid biases, as I think that's primary care is very dispersed and seems more easy for large trusts to get involved. It's a brilliant point. I think it's fair to say we, Amanda, have worked with PCNs directly, not just in this region but elsewhere, on specifically commissioned programmes. And Kim, I know you've got your hands up, you might want to come in here.
Except to say that we're passionate about wrapping our workforce around the patient, around the citizen, rather than around the profession, so that we have at the heart the people that we are providing care to. But in addition, I'd like to say that we've provided a phenomenal amount of detail in this webinar, and the most important thing is that you keep connected with us, and we will try and help you in any way we can. And the main forum is probably through the communities of practice, so we're looking forward to engaging with you in those.
Yes, and of course we're very interested in working with our citizens and partners, the people that we are undertaking the transformation for. So at UEA we have the Citizens Academy, we are linking with citizen senates and looking at the community assets, not only in the people but also the environment and the cultures and the heritage that we have, not only in our region but wherever people are working, their place-based understanding of the assets that are available in the communities as well. So lovely point, Amanda, thank you so much. So I'm aware we've reached the end of our webinar's hour. Phil, I don't know if you've got any closing comments that you'd like to just add while we've got you here.
Sorry, just trying to come off mute. No, thank you for colleagues for engaging today, and certainly a platform to move forward from, and I look forward to obviously engaging with colleagues going forward, but this is absolutely crucial going forward as part of the changing landscape across systems, and picking up on the point around absolutely across the full system, including primary care as well, but very supportive of this infrastructure that's needed going forward, and look forward to working with you all. Thanks,
Phil. And thank you to everyone who's contributed, whether you've been on the chat, whether our speakers, our people that have pre-recorded their work with us. I think that we are literally on a roller coaster together. We'll have highs and lows, no doubt, but actually this should be a really energizing and invigorating environment and a space to be. So I look forward to engaging with you in whatever capacity that's going to support and enable us to deliver the best care and be the best practitioners and personnel that we can be. So thank you again. Do watch this again, get in touch with us in any way you need to. Thank you so much, and have a lovely rest of the day, and speak to you again very, very soon, I hope.